All right, so we're going to go ahead and start. Good morning, everyone, and welcome to the 2022 Employee Benefits Open Enrollment Session. My name is Wanda Caldwell, and I am the Benefits Manager. Assisting me today is Maria Martin, Benefits Consultant, and Madison Little, who will be serving as our Zoom producer and moderator. Also, we have representatives from our insurance carriers. Some will be presenting, and all will be available for questions that you might have. I'd like to take a minute to introduce them to you. From Blue Cross and Blue Shield of North Carolina, we have Ms. Jasmine Walden. From CVS, Sarah Vaca. From Cigna Dental, Beth Barnes. From Imed, Brian Boos. And from Marathon Health, Caitlin Cross. We have a lot of important information to share with you today, but before we get started, I must inform you that this presentation is being recorded and that it will be saved and available on MacWeb within 24 to 48 hours in case you miss any part of the presentation. We want this meeting to be about you, so please feel free to ask questions after each presenter, or if you prefer, you can put your questions in the chat box. So let's begin. Our topics for today will be the following. Changes in 2022, what's changing? Medical options. We'll talk a little bit about the dental and vision options, pre-tax options, Marathon Health, and voluntary benefits. We want you to know that your questions are important to us. Please remember, again, that these sessions are public, and we have a responsibility to protect your personal health information. I just ask that you compose your question in generic or general form, and please try to refrain from giving out any personal or private information. If we are unable to answer your questions during this presentation due to time or content, please reach out to the respective insurance carrier or the Employee Services Center at 704-432-6947 for assistance. So what's changing in 2022? Both of our medical plans, the PPO and the high deductible plan that has a health savings account, are increasing the co-insurance from 25% to 30%. Remember that the cost sharing is the sharing of costs by the insurance and the member. Therefore, once you hit your deductible, you are responsible for only 30% of that shared cost until you hit the out-of-pocket annual maximum. Teledoc will be the new telehealth service provided by Blue Cross Blue Shield. The pharmacy coinsurance is also increasing from 25% to 30%. The county's contribution to the health savings account for 2022 plan year will be $500 for individual coverage and $1,000 for family coverage. Okay. Effective January 1 of 2022, Imed will be the vision carrier for the county. We currently have United Healthcare, but January of next year, we will be with Imed. We are slightly increasing the rates for medical, dental, and vision. Under the voluntary benefits, the critical care plan is changing its name to critical illness. So let's talk about our medical plans. Mecklenburg County has two medical plan choices. There's the traditional preferred provider organizational plan. That's the one that we call PPO. And then there's the high deductible health plan with a health savings account. In short, we have an HD, HP with an HSA. That's the acronym. There's not a one plan better than the other. I'll go into just a little bit more detail in the next couple of slides. So what's the high deductible health plan with the health savings account offer? Well, it does have a high deductible, but it also has lower premiums. Preventive visits are covered at 100%. You have the 30% co-insurance, and you have the health savings account, tax advantage savings account. The county contributes to the health savings account. For the 2022 plan year, Mecklenburg County will contribute, again, like I said earlier, $500 for the individual coverage and $1,000 for the family coverage. But you can also make contributions via the payroll deduction up to the IRS annual limit. The annual limit for 2022 is $3,650 for individual, $7,300 for family coverage. And if you are over the age of 55, you can also contribute an additional $1,000. Remember, the health savings account can be used to pay for your out-of-pocket medical expenses, such as prescriptions, co-pays, and the deductible. The nice thing about the health savings account is that you can roll over any unused funds to the next year. Now let's talk about the Preferred Provider Organizational Plan, or the PPO as we know it. If you were hired before January 1 of 2017, you can elect or choose to elect the PPO plan or the high deductible health savings plan that has a health savings account. With the PPO, you have a lower deductible, but you have higher premium. You also have the option to participate in the healthcare flexible spending account, that's the FSA, which is also a tax advantage account. Your preventive visits are covered at 100%, and you have a copay of $25 for office visits to your primary physician. And there's a co-insurance of 30%. As I mentioned, the flex spending account is a tax advantage benefit as well. At the county, we have the healthcare FSA, a dependent care FSA, and a commuter reimbursement FSA. You can only elect the healthcare FSA with the PPO plan, or if you decide to opt out of the county's medical program altogether. A few things you should know about the county's FSA plan. The healthcare FSA, the funds are front-loaded at the beginning of the year, and your employee contributions are deducted from each paycheck. More importantly to remember is that any unused funds in the healthcare FSA at the end of the calendar year is forfeited. It is a use it or lose it plan. However, the IRS guidelines are subject to change, just like we had a couple of changes, adjustment due to COVID. Just keep in mind that typically the healthcare FSA is a use it or lose it plan. Dependent care FSA can be used to pay for daycare expenses for dependents under the age of 13, as well as adult care. The The funds are not front-loaded, and you cannot roll over any unused funds at the end of the plan year. Now, the commuter reimbursement can be used for reimbursement of bus passes, light rails, and van pool expenses. Rollovers are allowed from year to year for this particular FSA. Any questions so far?
I don't have any in the chat. Oh, let's see, one person. Melanie? Not sure if she, okay. All right, so she wrote, typically dependent care could be used until March of the next year. Is that no longer true?
That is true. There is a period in which you can take advantage of the plan up into the middle of March. So you can file your claims up until the middle of March.
She also wrote, can flex spending account be used for children that are not covered under your plan?
Flex spending account, or you can only use that for eligible, at what the IRS deems as eligible dependents. So if you have a dependent that you carry on your taxes, but yet are not on our medical plan, you can use it. But here again, they're IRS as what the IRS deems an eligible dependent.
All right, let's see our next question. If you opt out of the county medical insurance, can you keep the HSA account?
So I'm going to answer that question this way. Let's say this year you were participating in the county's high deductible healthcare account, and you have an HSA, you have money or a balance in that HSA account, and you want to opt out next year. That health savings account is yours. That belongs to you. You can use it for any eligible medical expenses. So if you currently have a health savings account, that belongs to you. I hope that answered that question.
All right, our next question, do we calculate the HSA contributions on a 26-week period or a 24-day period?
Typically, it's calculated based on the pay period that you are under. So if you're under a 26 pay period, then yes, 26. I do know that we have some nurses, 10-month that are on a 24-month pay schedule. So it's whatever that you fall under.
Our next question, when it says 500 for individual and 1,000 for family for the county's contribution, do husband and wife count as a family, or do you have to have children to qualify?
For the high deductible health plan, there's just two levels. There's the individual and family. So a family could be just you and your spouse, or your family can be just you and your children, or all three.
Our next question, can we use Marathon Health even if you are under the PPO plan?
That is a great question, and yes, I'm going to answer that, but we will get to more information about the Marathon Clinic later in the presentation. I love it. So Madison, let's pause there because we had a lot of great questions, and we'll hang around after the end of the entire presentation if there's additional question that comes that you have regarding the medical and flex spending account plans. All right. So at this time, I will now turn it over to Jasmine Walden, a representative from Blue Cross Blue Shield, to provide additional information. Once she is done presenting, feel free to ask questions pertaining to the medical plan. So good morning, Miss Jasmine. Are you ready for me to stop sharing?
Yes, ma'am. Good morning, Ms. Wanda.
I have stopped. Are you good?
Yes, ma'am. Can you see my screen?
I can.
All right. Good morning, everyone. As Ms. Wanda stated, my name is Jasmine Walden from Blue Cross and Blue Shield of North Carolina, and welcome to this presentation about your health benefits offered to you by Mecklenburg County Government and Blue Cross and Blue Shield of North Carolina. Today, I want to spend a few minutes highlighting some things you should know how to get the most out of your health plan. First, we will discuss finding a doctor. You can save money by visiting doctors who are in the Blue Options Network. To find out if your doctor's is in the Blue Options Network of providers, just call us at the number on the back of your health insurance ID card. You can also go to blueconnectnc.com and use our Find a Doctor tool. Anyone can find basic information about our in-network doctors, but if you're looking for more details, you'll want to log in. And it just highlights the login box there where you would use your username and password. When you log in, you will see this homepage. Just click on Find Care to get more information. As part of your preventive care services, you can see an in-network nutritionalist 10 times per year for no charge. These experts can help you start good food habits, create healthy, budget-friendly menus, and know what to eat if you have health problems. And again, that's 10 times per year for no charge. As you get the care you need, you can have your health plan information right in the palm of your hand. Blue Connect Mobile lets you securely connect your Blue Cross of North Carolina health plan whenever you want. You're able to get your digital ID card, view your claims, track benefits, view your deductible and out-of-pocket expenses. You can also call customer service or send a message through the app. Fingerprint and Touch ID sign-in is available on certain devices. And everything on the mobile app is available in Spanish. Blue Connect Mobile is free for Blue Cross of North Carolina members. It's also available on the App Store or Google Play. And for support or more information, you can visit bcbsnc.com/mobile. And our Blue 365 program can help you save money while you stay healthy. Blue 365 offers discounts on healthy products and services, everything from gym memberships to nutrition programs to laser eye surgery. When you sign up, you'll get special weekly deals from well-known companies delivered right to your email inbox. From sports gear to personal care, you'll always find healthy savings with Blue 365. Joining is easy. You can just visit the Blue 365 website to get started, or going to www.bcbsnc.com/Blue365. And with your health plan, you can also chat with a doctor on your smartphone, PC, or tablet. Your health plan includes telehealth services from Teledoc. With telehealth, you visit a doctor without going to the doctor's office. It's a great option if you have a minor health problem or behavior health problems and can't see your regular doctor. It's often more convenient and often costs less than going to an urgent care. With Telehealth by Teledoc, you can talk with a board-certified doctor by secure online video 24 hours a day, 7 days a week. The whole visit takes place through your Teledoc app or your computer. The doctor can even prescribe medicine and send your prescription to your local pharmacy. If you choose the PPO copay plan, you will pay $25 per Teledoc visit. If you choose the HSA plan, you will pay 30% after you meet your deductible. You may use your HSA card to pay for telehealth visits. Teledoc can handle many non-emergency health problems like the ones in the chart. No matter if you're at home, at work, or traveling, you can use Teledoc just about anywhere, anytime, day or night. Sometimes life can be too much to handle. Situations like stress at work, changes at home, or the loss of a loved one can make you feel like you've got nowhere to turn, but you do. With Teledoc, you also have access to licensed mental health professionals who can help you deal with stress, depression, anxiety, and much more. Plus, you will have the option to choose a telephone or video consult based on your comfort level. You would simply call Teledoc to make an appointment for your consultation. There are 3 ways to get started with telehealth with Teledoc. You can download the Teledoc app, visit them online at www.teledoc.com, or call 1-800-TELEDOC. Go ahead and activate your account after January 1st. So if you need telehealth, you'll be ready. Thank you for your time. We're glad you have coverage through Blue Cross and Blue Shield of North Carolina. Remember, we're here to help you get the most out of your health insurance plans. If you have questions, please don't hesitate to call us or visit blueconnectnc.com. For the open enrollment, we do have a hotline that's also available to you. You can give us a call at 1-877-224-3305. Thank you.
Thank you, Jasmine. Do we have any questions for Jasmine?
I do have one question in the chat. How do we find the nutritionist? And also, do we pay a copay for each visit with the nutritionist?
For the nutritionist, you can find a nutritionist near you by going to the Find a Doctor tool, and you can find a local nutritionist in your area, or you can call us at the number on the back of your card. For the nutritional counseling visits, no, you have 10 visits per year at no charge. So there's no copay associated with those visits.
So Jasmine, did you stop sharing?
Yes, ma'am.
Okay.
And I see a question regarding the Blue 365 program. I will put the link in the chat for you.
All right. All right, so can everybody see my screen now?
We cannot.
You cannot.
Not yet.
Okay, so let me, I knew I was going to have a problem with this. All right, give me 1 second. Do you see anything, Jazz? Madison?
I do not.
Sorry about the technical difficulties, guys. So here we go. I've got it. How about now?
Looks good.
Thank you. All right. So thank you, Jasmine. So let's talk about the county's dental plan. Our dental plan is administered by Cigna, and the county offers two types of plans to choose from. We have the standard plan and the enhanced plan. Under the standard plan, you have a calendar year maximum of $1,000 for the individual coverage. There is a $75 deductible for individual coverage and a $225 deductible for family coverage. Orthodontic coverage is not available with the standard plan. Under the enhanced plan, you have a calendar year maximum of $1,500 for individual coverage, a deductible of $50 for individual and $150 deductible for family coverage. Orthodontic is coverage and available with a lifetime maximum of $1,500 per individual. Note, orthodontic coverage is available for dependent children under the age of 19. At this time, I will turn it over to Beth Barnes from Cigna to provide additional details regarding our dental plans with Cigna. After she's finished presenting, again, you have the opportunity to ask questions pertaining to the dental plan. Good morning, Beth.
Good morning, Wanda.
How are you?
I'm very well. Hope you are.
I am well. I'm well. Thank you. So, Beth, I'm going to turn it over to you.
Okay.
Do I need to stop sharing or can you just share?
Nope, you're gonna need to stop sharing so that I can go in and share my screen, please.
Okay. I don't know why this is trying to give me a hard time. Hold on, Beth.
No problem. In the meantime, I did see a question come in around orthodontic coverage isn't available for adults. It is not. Orthodontic coverage is only available for dependent children up to the age of 19.
Here we go.
All right, perfect. All right, let me go in and share my screen. Okay. Give me a thumbs up if you can see my screen, Wanda or Madison. Perfect. All right. So good morning, everyone. I'm going to spend a few minutes going over how to locate an in-network dentist and some other programs and services available to you through Mecklenburg County. With Mecklenburg County's dental plans, you can choose to see a dentist that is in Cigna's network or not. You have the option. If you choose to see a dentist that is in Cigna's network, you can save money for your dental expenses. To locate a dentist in Cigna's network, you can search for a dentist multiple ways. Number one, if you do not have dental coverage through the county yet, you can search online at Cigna.com to find a dentist. We have a nationwide network of dentists. When you choose your network, you'll choose the total Cigna Dental PPO network. Number two, if you do have Cigna dental coverage today, you can access our member portal through My Cigna to locate an in-network dentist. Good news is that currently 90% of the county's population is actually using My Cigna. So I'm hoping that most of you that's attending today's webinar is familiar in using our portal. Our third and final way, you can give us a call at 1-800-CIGNA24 when you need us. So we are available 24/7, 365. So if you have any questions in locating a dentist, your benefits, your dental benefits, or any questions, just give us a call. Estimating your dental care costs. My Cigna also offers convenient tools to help you estimate plan, and budget your dental care costs. You'll find cost estimates for dental treatments and procedures based on your plan information and dentist contracted fees. And you will be able to compare what it costs when you visit an in-network dentist versus an out-of-network dentist. The Cigna Dental Oral Health Integration Program is a program that reimburses out-of-pocket costs for specific dental services used to treat or help prevent gum disease and tooth decay. The program is for people with certain medical conditions such as heart disease, stroke, maternity, chronic kidney disease, organ transplants, lupus, and rheumatoid arthritis, to name a few. Again, this program is for people with certain medical conditions with a higher risk of oral health issues. There is no additional cost for the program, and if you qualify, you get reimbursed for out-of-pocket costs for certain dental procedures. Cigna Dental Virtual Care. While we recommend that you contact your dentist first to see if they can provide virtual care, we recognize that this may not always be possible. Teledentist connects you with a licensed dentist who, through a video call, can help address urgent dental situations like toothaches, infection, swelling, bleeding, and more. They can also prescribe medication to be filled at your local pharmacy if necessary. And virtual care consults are processed as in-network claims and have no copay or coinsurance, but it does apply to the county's plan annual maximum. So you can access dental virtual care through MyCigna as well. All right, so Healthy Rewards Program. So through Cigna Healthy Rewards, Cigna dental members have access to discounts on a full range of health and wellness programs and services often not covered by traditional plans, insurance plans. These programs include weight and nutrition management, fitness, tobacco cessation, vision and hearing care, vitamins, health and wellness products, anti-cavity products, financial planning, and healthy lifestyle products. To access Healthy Rewards, visit mycigna.com and click on the Wellness tab. Okay, any questions regarding the dental plan?
We do have two in the chat. The first question, my daughter is 24 and just graduated from grad school. Can she be added to my dental plan? That may be a question for Wanda or Maria.
Repeat that question again, Madison.
Sure. My daughter is 24 and just graduated from grad school. Can she be added to my dental plan?
Yes. Well, let me answer it this way. She is considered an eligible dependent up until age 26. If you want to add her for the 22 plan year, if she's currently not a dependent on the dental plan now, you can certainly do that and add her during open enrollment up until age 26.
Let's see, our next question. Can you have two dental plans, such as a county plan and spouse's dental plan, to help maximize orthodontic coverage for a dependent?
Yes, you can have multiple dental plans. That is an option.
Our next question, does our coverage cover wisdom tooth removal?
It does cover wisdom teeth removal. I believe that it falls under basic services, but it is a covered benefit, yes.
And that's our last question.
All right, perfect.
Thank you, Beth. Okay, how are we looking on the slides? Do you see the next slide?
We do, but you just need to switch your view.
Okay. Sorry about that. You see my notes page. How about now?
You're good.
Great. Thank you, Beth. And as I mentioned earlier, we are switching vision carriers effective January 1, 2022. Our new partner will be Imed. The county will continue to offer 2 plans for consideration, a standard and an enhanced plan. Both plans have a 0 copay to an in-network provider and a $180 frame allowance. Although both plans are similar, there are some differences. So now I'm going to turn it over to Brian Booth from Imed. Brian will share additional information regarding the county's vision plans with Imed. Again, after he is done presenting, you'll have an opportunity to ask him questions. Brian.
Good morning. Can you hear me okay?
Yes, sir.
All right. If you can stop sharing, I'll try to share. Let's see how successful I'll be. Okay. Can you see my screen okay?
Yes.
Yes.
All right. Excellent. Well, good morning, everyone. Yes, I'd like to talk to you about the vision benefits that are being offered by Imed. As you can see here, the first thing you need to decide is, should you enroll in vision benefits at all? So the thing that we would like you to focus on is whether you need glasses or can see just fine. Vision benefits are certainly a wise choice either way. They can help you not only save money, but also help you with your overall health. So let's start with a quick video here. Hopefully we can hear the audio. It's thinking.
Should you enroll in vision benefits? Grandma might say, if it ain't broke, don't fix it. We love Grandma, but even age-old wisdom like this could use an update. With Imed, good things come to those who don't wait. Vision benefits help pay for eye exams, something every pair of eyes could use, even if you don't think you need glasses. An apple a day may keep the doctor away, but an eye exam each year can help spot signs of diabetes, high blood pressure, and other health problems. Unlike what you've heard, you can always get what you want. With Imed, you can choose any frame or brand, and your favorite doctor is probably already in our network. When you enroll in Imed, a penny saved is several dollars earned. Member discounts and savings on vision-related products and services like LASIK give you more buying power. So in this case, less really is more. We believe nothing worthwhile is easy, except using Imed. We'll hook you up with everything you need: a cost estimator, provider locator, members app, and more. You won't even have to file a claim when you see an in-network doctor. We do it for you. That's right. No pain, lots of gain. There's a lot of wisdom in having vision benefits. So check yes for Imed and experience these benefits for yourself. After all, seeing is believing.
Great. So as you saw there, there's a focus on value or savings for the member, as well as a focus on wellness. On the value side, we're going to talk a little bit about the discounts and savings that you can receive when you're purchasing services, as well as getting an eye exam. And I'll get into those details in a few minutes here. As well as you saw there on the video, there's a good focus on wellness, because we can help spot serious, not only eye conditions, but overall health conditions just through a comprehensive eye exam. So that's very important, as well as just protecting your eyes from digital eye strain, which can, lead to headaches, dry eyes, things like that at work. So you'll want to really take advantage of the vision care plan. As we alluded to earlier, there's 2 different plan designs. There's the standard plan and the enhanced plan. On the standard plan, it includes a comprehensive eye exam every 12 months with a $0 copay. So it doesn't cost you anything as a member to go get your eyes examined. And then you'll also receive a $180 frame allowance every 24 months, as well as access to fixed pricing on lenses and lens options with a $20 copay. And that's available every 12 months. For those contact lens wearers, there's a $150 contact lens allowance with coverage for fit and follow-up on your eye exam every 12 months. So those are the very basic benefits under the standard plan. On the enhanced plan, again, very similar. The only thing that you'll see that's changed here is in that middle section at the bottom, which is $0 lens copay for your lenses and various lens options. The prior plan, the standard plan, had a $20 copay. The other thing that you don't see here, and you'll have to look into the plan details, is there are numerous fully covered in full lenses and lens options, especially for some of the more expensive services like progressive lenses and anti-reflective coatings. There's going to be much less member out of pocket with this enhanced plan, which is why, you know, it costs a little bit more, but there's a lot of value that is in there. So you'll want to make sure you look at the details on the plan summary. A few more benefit basics here outside of the plan design itself. The frequency is based on a plan year, or in this case, it's a calendar year. So you do not need to wait a full 12 months between services to use your vision benefits again. As long as you go into the next calendar year, you are fine. So one of the things I'll also call out, since you're moving from UHC over to Imed, you do not have to worry about whether or not you purchased frames in this current calendar year. You do not have to wait 24 months. Once you start with Imed in the beginning of the next plan year, your benefits will reset immediately starting on January 1st. So you can take advantage of that, that change in carriers immediately. Also, contacts are available in lieu of lenses only. So I mentioned the two different benefits previously. There's a separate contact lens benefit. That's in lieu of using the lenses that are part of a pair of glasses. So again, you're entitled to a full pair of glasses, the frame and lenses, or contacts and frames. But if you use the contacts and frames option, you would actually have to pay out of pocket for the lenses that go in those frames. And again, just to remember that the frame frequency is still every other plan year. Now, all of the best benefits are accessed by going to an in-network provider. So this gives you an overview of what those providers look like. The main thing I want you to remember is that you're looking at Imed's Insight Network. We'll talk about finding a provider in the next page here, but within our Insight Network, you'll see that we have lots of choices of both independent and retail providers, over 187 locations just in the greater Charlotte area. Those national retailers that you'll be familiar with would be a Lens Crafters, a Pearl Vision, Target Optical, Walmart, Sam's Club, for example. There's also local or regional retailers, including providers like My Eye Doctor, America's Best, Clarkson Eye Care. There's online options for those folks that want to purchase online. Then you can go to 5 different online options that you'll see there, whether it's lenscrafters.com, targetoptical.com, rayban.com, glasses.com, or contactsdirect.com. So plenty of provider choices for you. Now, when you want to try to find the eye doctor that's right for you, you can certainly go to our provider locator on our website at imed.com, and you'll have to remember to choose the Insight Network. You'll see several different network choices out there. Insight is our most common one that you'll see, and you want to make sure you select that one. And then you can locate providers nearest to your address if you'd like, or you can search in the entire Charlotte area if you're looking at different providers. There's also a mobile app that you'll be able to download and look at providers that way, as well as looking at a welcome kit that we'll send you, and I'll talk about that in a minute here, that will provide you with a list of providers as well. I mentioned early on about the extra savings, so certainly there's discounts that come into play that make it very, very valuable for members. Some of the extra discounts that are most commonly used. This 40% off an additional pair of glasses. This is really handy for anybody who has children who may lose their glasses and you've already exhausted your benefits for the year. You can get 40% off a complete pair of glasses. You can use that as often as you need to. There's also discounts on LASIK. There's discounts if you have the overage. If you want to spend more than $180 on a frame, you'll get a 20% discount on that. You'll get 15% off discount on conventional contact lenses, 20%, pretty much 20% discount on anything that's not covered under the plan, including non-prescription sunglasses. And we also have discounts on hearing exams and set pricing on hearing aids. Lastly, I just want to make sure that you take advantage of the various member tools that are out there. I mentioned the term a welcome kit earlier. Anybody that signs up for the Imed Vision Plan will receive a welcome kit that gets sent to your home that includes a couple of ID cards, as well as a summary of your benefits, and then a mini listing of providers. It's the 4 closest independent providers and 4 closest retail providers to your individual resident address. Then there's lots of tools that you can have available to you on either the members app or the member web. And you can see some of those here. Really nice tools that are available. You can set reminders of when it's time to change your contact lenses. You can load in your prescription so you can save it there. On the member web, you actually have access to a cost estimator tool. So that's something that you can hopefully get a little bit educated about some of the types of services that you might be purchasing before you actually go to the doctor's office. So you can kind of get a feel for what that's going to cost you out of pocket wise. So lots of great tools out there for you as well. And with that, I'll open it up for any questions.
Our first question, let's see, are diabetic eye exams considered as comprehensive, or is that covered through our medical plan?
If it's a comprehensive eye exam, they'll be doing a normal eye exam. But if it's something specifically that you're looking for, you know, to detect something specifically within diabetes that you have, that might be covered under your medical plan. I would certainly check with your provider first. But you can, as a diabetic, you certainly can get your routine eye exam through the Imed Vision Plan.
Our next question, does Imed cover glasses with Warby Parker?
No, they do not. But you can see we have lots of other options, 5 different online options, as well as a plethora of brick and mortar stores. But that is one provider that is not in our network.
All right, our next question. If I want to stay with my eye doctor who is not an Imed doctor, will Blue Cross and Blue Shield cover some of my cost?
Okay, I'll answer the first part. If you want to stay with your current provider who's not currently in our network, we do have out-of-network benefits that come into play. So you can certainly use any provider you want to. If they're not in network, you have access to some out-of-network benefits, and you'll want to make sure you look at the plan summary to see what those are. In terms of whether or not that's covered under the medical plan, I wouldn't think so, but I'll leave that up to Wanda.
Vision care is not included in the medical plan. That's typically why we have vision coverage with Imed.
I see another question about, does Imed cover prescription sunglasses? Absolutely, they do. So that certainly is an option under your vision plan when you go to choose your glasses. And I just along that same sunglass issue, just to remind you, I mentioned there's also discounts for non-prescription sunglasses as well.
I have a question.
Mm-hmm. Yes.
Does the vision cover keratoconus?
I'm not sure when you say, does it cover it? That sounds that sounds like a medical condition. In terms of what's covered is certainly just the comprehensive eye exam piece would still be allowed, and the purchase of services, whether it's glasses or contacts. If it's anything more specifically a medical issue, that would be covered under a medical plan. Does that make sense?
Well, yeah, some vision plans cover it and some do not. Okay. So Wanda, my other question would be, does Blue Cross Blue Shield cover keratoconus?
Can we take that one offline? Because I do not know the answer to that one. I can certainly reach out to my Blue Cross rep to find out specifically if they cover that, if we cover that.
Okay.
So make sure we have your email, the question and your email, name and email, so that we can get the answer and get back to you on it.
All right, thank you.
You're welcome.
Okay. Any other questions for me?
We have two more that just came in. This may be for Wanda. Does our medical plan not cover medically related eye exams? Example, if someone had glaucoma and needs to be checked throughout the year.
Okay. That sounds like, well, you know what? Let me confirm. I don't want to speak out of term. Can we get back to that individual too, Madison?
That works.
Thank you. Make sure I have her name, the name and email.
Okay. And then our final question, is the progressive option covered?
Yes, progressive lenses are covered under both the standard and the enhanced plan. That was one of my examples that I used earlier about the advantages of the enhanced plan, because progressive lenses don't cost anything under the enhanced plan. It's a $0 copay. So versus there are different levels of copays on the standard plan depending on the level of the progressive lens that you're purchasing. It's a pretty big range of progressive lenses, and the copays range from $105 to $195 depending on the lens under the standard plan. But again, under the enhanced plan, it's a $0 copay.
That looks like our last question.
Thank you, Madison.
Okay.
All right. How am I looking, Madison, as far as the slide?
You look good.
Yeah. Thank you. Thanks, Brian. So most of you are probably familiar with the Marathon Health Clinic, but there may be some that are not. Marathon Health is an independent provider of primary care clinics. They have several near-site locations and offer services such as primary care, biometric screening, chronic condition treatment, lab work, and personal health coaching, just to name a few. To speak further on Marathon Health, I'm going to turn it over to Caitlin, and feel free to ask Caitlin any question that you may have after she's done presenting. Hi, Caitlin.
Hi, Wanda. Thank you so much for the introduction. I appreciate it.
You are welcome.
Thank you.
I'm going to stop sharing and hand it over to you.
Okay, perfect. Thank you. And while I gather that as well for my presentation, I just want to say good morning. My name is Caitlin, and I am a client advocate with Marathon Health. And I thank you so much for having me here today. I'm very excited to be here. I realized I was off camera when the question regarding Marathon Health was asked before, but my smile was so big. So I'm glad you're asking questions, and I'm excited to share more information with you. And so here in just a moment, I will play a recorded video that we created. The voice in the video is Jenna Ewing, who's also a client advocate with Marathon Health. And if you have any questions during the video, please feel free to place them in the chat. And I do want to provide a little caveat that just in full transparency, I am new to Marathon Health, and I may have to take your question back to ensure I provide you with the correct answer. So if I did not reply directly to your question, please know I'm taking it back, and I will create a document with all of the questions, and I'll provide answers to those and provide that document back to Wanda so we can ensure you all have the correct information. So let's get started. Here's Marathon Health.
My name is Jenna Ewing, and I am the client advocate with Marathon Health in the Charlotte network. The purpose of this presentation is to give you a better understanding of who Marathon Health is and how we can help serve you and your family. Marathon Health is a primary care physician's office with 6 health center locations in the Charlotte metro area. Our 6 health centers range in hours from 7 a.m. till 7 p.m. All of our centers are by appointment only to reduce wait times. We see members on the benefits plan in your family ages 3 and up, so that includes your spouse or dependents. The 6 health centers are located around the 485 loop in Charlotte. Our newest health center location we opened in Matthews, North Carolina in March of 2020. As mentioned before, all of our health centers operate Monday through Friday, with the exception of our North Lake location, open on Saturdays from 8 a.m. till 12 p.m. You have access to all 6 of these health centers, so should you want to get labs done at one of our health center locations, but see a provider at another, you may go to any of the 6 health centers included in this network. The design of this model was so you could have access to care close to home and work. This here is a service overview. The purpose of this slide is to give you a better understanding of what Marathon Health can do for you and your family. We operate as a primary care physician's office, and what that means is we can do your annual routine physicals if you are 16 and up. We can treat you for acute and preventive needs, so if you get sick or if you would like your chronic disease managed with us, that includes high blood pressure, diabetes, thyroid issues. We also have a dedicated referral team that can help connect you with somebody in network if it's something that we can't handle at the health center level, such as a sleep study or dermatological referral. We do see children aged 3 and up on the medical plan. We see children for acute needs, such as cuts, bumps, bruises, sprains, or if they're sick and have an ear infection. The one caveat to that is we see children for camp and sports physicals. Our wellness services that are included with your Marathon Health access is health coaching and behavioral health needs. All behavioral health services as well as health coaching services are free at no cost to you. This can be one-on-one health coaching or group wellness programming. We have an on-site laboratory at each of our 6 health center locations. Labs are free at no cost to the patient. We also have an on-site dispensary and a home med pharmacy. The on-site dispensary is used for acute medications when you are sick or need something at the time of the appointment. Our home med delivery service is where we leverage this pharmacy for chronic care medications, such as thyroid medications or blood pressure medications. In 2020, due to the COVID-19 pandemic, Marathon Health transitioned their model of care to not only being telephonic and in-person, but launched virtual care. As a patient of Marathon Health, you now have access to our providers virtually, telephonically, or in person. The 5th mark on this slide is Marathon Health Portal. The portal is where you can communicate with our ambassadors, our clinical team members, you can schedule appointments, as well as access test and lab results. The way that our model is set up is by appointment only, and those appointments are either 40 minutes, 30 minutes, or 20-minute appointment types. The 40-minute appointments are typically for new patients to establish care. This also is included in our annual physicals. A 30-minute appointment is going to be if you are a sick patient and it's a little bit more complex, or if you're new and not feeling well. The 20-minute appointment is for routine care for established patients. So for those that are established with us, we know your medical history, your current medication regimen, and you're just not feeling good, or if it's just a check-in on your chronic care management where a quick set of labs are needed and just to touch base with one of our providers on how you're doing. As I mentioned before, we do have medications on site as well as a home med delivery system. We encourage patients that do not have a primary care or a provider that they see in the network to leverage Marathon Health as their primary care of choice. We can not only manage the current medications that you're on, but do routine lab work and your annual physical for preventive reasons at no cost to you, regardless of the plan that you're on. All preventive services are free. We do have an on-site laboratory at our 6 health center locations. Those labs are at no cost to you and anybody that is on the plan. Sometimes we have patients that have an established primary care in the network, and we encourage that. We're not here to replace your primary care if you have one, but we are here to be one if you need one. We sometimes have patients that use us strictly for our labs only. Let's just say that you have a specialty doctor such as a cardiologist, and you have to get labs every 3 to 6 months. You can have that specialty doctor fax Marathon Health that lab order, and we can draw those labs for you on that specific cadence. We would then send the results of those labs back to your specialty doctor, and there would be no fee for you as the patient. As I mentioned before, we do have a dedicated referral team to the Marathon Health Charlotte network. What this means is if you were to come see one of our providers and you were having issues with sleep, or you had a mammogram up, or colonoscopy that was due, or let's just say your child fell at school and you're uncertain if they need an x-ray or not, you can schedule an appointment with one of our Marathon Health providers that can assess the current situation and the need for the referral, and they would connect you with our referral team. Our referral team will take your medical insurance, put it through our system, and reach out to you within a 24 to 48 hour timeline, depending on the need. They would then schedule that appointment for you and follow up with the results to take the heavy lifting off the patient. Health coaching and behavioral health services are a part of the Marathon Health benefit. We have 3 dedicated health coaches in the Charlotte network that consist of a certified diabetic educator that is a registered dietitian, an exercise physiologist, and a CHES certified health coach that is passionate about spiritual and behavioral health. We also have a team of 4 behavioral health clinicians, varying from licensed professional counselors to licensed clinical social workers. All health coaching and behavioral health appointments are free at no cost to the member. So how do I schedule an appointment with Marathon Health? You can call our centralized scheduling team, our member relations team, Monday through Friday, 7 a.m. till 5 p.m. or Saturday mornings. They can help set up an appointment for you. You can scan the QR code below. You also can register online at member.ourhealth.org and create a profile where you can go into the member portal and self-schedule an appointment that way. We appreciate your time in listening to our presentation. If at any point you have any questions about Marathon Health and what we can do for you and your family, feel free to reach out to our member relations team or go to marathonhealth.com and visit us. Check us out. Thank you for your time and have a great day.
Thank you, Caitlin. Anyone have any questions for Caitlin?
We did have several questions in the chat. The first question, can my health information be uploaded to my Atrium account?
Ooh, that is a fantastic question. I'm gonna, if it's okay, I'm gonna take that question back just so I can confirm.
Okay.
If that's can be intertwined between our system and Atrium system. I'll get a confirmed answer on that if that's possible.
Okay. Let's see, our next question. If I have guardianship of an adult, can they utilize your services under my plan?
So let me try to answer that one, Caitlin.
Thank you, Anna.
If that individual is considered a dependent, an eligible dependent. So without knowing all of the details, I think that's the best answer I can give right now. So only eligible dependents are able to utilize Marathon services, and that eligible dependent would need to be on our plan.
Thank you, Wanda.
Our next question, Wanda, this one is probably for you. Does our personal health information get shared with HR?
Absolutely not. Absolutely not. We do get aggregate information, okay? And so that is information that is gathered basically for utilization for us to see how the plan is working. But we do not have access to individual personal information.
Our next question is physical therapy offered through Marathon Health?
It is not. Oh, sorry, Wanda. I didn't mean to.
No, I was going to pass it to you.
Yes, it is not currently offered through Mecklenburg County at this point.
All right, our next question. The employee asks, can you repeat the information regarding labs for other providers?
Yes, oh, absolutely. So what can happen is if you have a lab scheduled, I'll give an example of if you see a cardiologist and they order labs for you to get done every couple months or so. If, for example, to go to your cardiologist's office to get those labs done every month or so, there could be a charge associated with just that office visit of going to the cardiologist. So kind of how we can come in and we can help with that is if you have your cardiologist or your specialty doctor send the lab order over to Marathon Health and to your provider at Marathon Health, and then make an appointment to have the labs drawn. You can go ahead and come in, we'll draw your labs. I think there's like 3,000 plus labs that we can draw. So there are quite a few different lab draws that we can do. If you ever wanted to give our health centers a call to make sure we can draw the lab that's being asked, you can definitely give us a call to verify that. But if you just have your provider send over the order to your provider with Marathon Health and get an appointment scheduled for that lab draw, we can help take care of that.
Thank you. Let's see, our next question, Wanda, this one may be for you. We have the options to take a healthcare assessment to reduce the deductible for next year. How does that work?
Okay, so Mecklenburg County has for a couple of years now, have a wellness incentive program. The program has specific requirements that employees have to meet in order to receive a premium discount, okay? I'll give you an example. This year, 2021, I mean, you had to complete your biometric screening and the health risk assessment. That's a questionnaire. It's an online questionnaire on Marathon site. You complete those two. If for some reason your biometric screening came back that required you to have health coaching, then that's an additional requirement, X number of health coaching sessions in order to complete the incentive requirement. Every year, the requirements is subject to change, okay? So 2021, it was the biometric screening and health risk assessment, and if it was required that you had some type of health coaching, that was the requirement for 2021. It's also for 2022 incentive. So next year, be on the lookout for Employee News Now announcement, information from Marathon Health regarding 2023 plan year incentive requirement, okay? So I hope that answered the individual's question.
All right, we have a two-part question next. How does the group wellness plan work? And also, what type of group wellness coaching does Marathon provide?
First question is, how does the group plan wellness work? The group wellness plan work?
Right.
I believe I answered that with the incentive requirement and you do these things in order to receive your premium discount for the upcoming year. The second part, Madison, was what now?
Let's see, next question. What type of group wellness coaching does Marathon provide?
That is a great question. I think those are typically, I want to say they're, my understanding, I believe they're like scheduled programs, and I don't know what the schedule is. So let me take that back and I'll look into that and get a clear answer as to what that entails and if there's any group programs coming up soon.
Yeah, I can give you one example of health coaching. Let's say your biometric came back and your weight might have been over the benchmark or something like that. There's nutritional type coaching that Marathon could assist with.
All right, our next question, has there been any consideration to add additional providers or extending hours to meet the needs? This person also wrote, appointments are very hard to secure during peak seasons for flu and COVID.
Yeah. So, Caitlin, I'm going to say that we've had that question come up one or two more times in other sessions. I had mentioned in one of the sessions that there has been some discussion with County and Marathon said that they were definitely looking at providing additional staff. I don't know the specific positions of that additional staff. So if you can add any more to that comment, that would be helpful. But I do know that Marathon is looking at adding additional staff.
Absolutely, Wanda. That is exactly my understanding as well. I know we are evaluating across the board, whether it is providers, medical assistants, nurses. We are evaluating the staffing and if there's any need and the potential need for more staff. And so I know that's something that our care team manager is looking into. And I don't know if there's any updates as far as still looking at the data to see what we what we can ask for, what resources we can get. But I'll get an update on that if it's past the evaluation stage of what we're looking for.
Thank you.
Thank you.
So,
go ahead, Wanda.
No, I'm sorry. Go ahead, Caitlin.
No, I was just saying thank you for the feedback about appointments. I definitely took very detailed notes on that as well, and we'll be taking that back to our care team as well and our care team manager.
Thank you. Madison, if we may have more questions in the chat, I'd like to kind of hold them for now because I'm looking at the time and it's 11:15. So I want to go through the rest of the presentation and we'll try to get to those questions in the chat afterwards. Is that all right?
That's fine.
Great, 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 great. All right, so let's continue. Now let's talk about the county's supplemental benefits, or some may call it our voluntary benefits. Mecklenburg County offers employees cancer, accident, medical bridge, and critical illness, which are offered through Colonial, and pre-tax benefits for those with critical illness, which is after tax. So the plans that I just mentioned, cancer, accident, medical bridge, or pre-tax critical illness is after tax, as well as pet insurance through Nationwide. Pet insurance is also an after-tax program. All of these plans are administered by our third-party broker called PeerScrew. These benefits are 100% employee contributed and are portable. Unlike the core benefits, coverage will remain the same unless you want to make a change. Remember, open enrollment is coming up. It is from November the 8th through November the 19th, a 2-week period. If you do not enroll or waive coverage in medical, dental, vision, and any of the flex spending accounts during this designated online open enrollment period, you will not have insurance coverage in 2022. So please, please, please make a note, highlight it. You have to make an election or you have to waive. And you can do that and make your benefit elections by going into MyHR. Log into MyHR, go to the employee self-service link or portal tile, click on the benefits tile, and click on benefits enrollment. To enroll in the following voluntary benefits, I mentioned them earlier, but here they are again: critical illness, cancer, medical bridge, accident insurance, pet insurance. Visit Pierce Group website. And the link is on the slide. Another thing to remember is that this is a great time to enroll or even update your 401k contribution, your 457, the North Carolina 529 college savings plan. So this is a great time to just review or enroll, if you're not currently enrolled, into one of these additional savings plan. And if you don't make the change, if you don't make the changes for the 401k, 457, and the NC 529 doing open enrollment, no problem. You can make changes to these plans anytime throughout the year. This is also the perfect time to review your beneficiaries. Oftentimes we tend to not think about it because it's not pleasant to think about, something that you want to think about. But it's something that we all need to do. Review your beneficiaries for your life insurance, your 401k, and other plans that have a beneficiary tied to it. All right. This is the most exciting part about the presentation today. Lots of good information, but to me, this is the best one. We are excited to announce that this year, we will have an open enrollment raffle, the first of our kind for Mecklenburg County. Those of you that complete your enrollment early will have an opportunity to enter into multiple raffles for a chance to win some really, really, really great prizes. And the prizes are listed in that blue dot, that blue circle: Google Home, Bluetooth speaker, Yeti cooler, and more. The drawings will be held on Wednesdays and Fridays during that 2-week enrollment period. The first drawing will be held on November the 10th, and we will announce 20 winners. Only those that complete their enrollment by midnight the day before will be entered into the drawing and have a chance to win. And notice the grand prize. The grand prize is a 50-inch smart TV. So don't forget that. It pays, or it could potentially pay, to enroll early. But you want to enroll anyway because you want to have health coverage at the beginning of the year. This slide is a list of resources that's available to you. Take a minute to look at it, jot it down, but I just want to point out that this information is also available in your open enrollment guide. Everyone should have received their guide by now. I know I've received mine, several of my colleagues have. So if you don't get to capture this information down today, just know that it is in your 2022 open enrollment guide. All right. I also want to mention it's not on the resource page that we just left, but the county has, for the second year, we have a virtual benefits fair that is available to you through MacWeb. So this is a resource that you can get on your medical plan, your dental, vision, health savings account, and some of the voluntary plans. The nice thing about this virtual benefits fair is it's available online 24/7. You can review it, sit down with your significant others, and make an informed choice for your upcoming election, your upcoming benefit elections. So this is a great tool to have. The second year that we've offered it, last year we received wonderful feedbacks, and so we decided to provide it again this year. So when you get a chance, go out there to MacWeb, click on Open Enrollment, and you'll see a link to the virtual benefits fair. Great information out there. So that concludes our presentation, but I believe we may have a special guest today. Do we, Madison? All right. So that concludes the open enrollment information session, but I'd like to turn it over to our work green partners. I'm not sure whether it's Aaron or Rebecca that's here today.
It's Aaron.
Aaron's here.
Hi, Aaron.
Hey, Miss Wanda.
So I'm going to stop sharing, Aaron, and turn it over to you.
Perfect. Thank you. All right. Let me share real quick. Can you see my screen? Getting the thumbs up, Madison, Wanda? Okay, cool. So show of emoji hands. How many people have participated in or heard of Work Green since they've been with the county? Great. So Work Green is Mecklenburg County's environmentally focused employee engagement and award program. In 2004, the Board of County Commissioners passed our first environmental leadership policy, excuse me, and we passed an updated version of that in March of this year. And that policy provides employees with opportunities and incentives to practice environmentally sound behaviors. And so to participate and register in Work Green, you have to visit the Work Green information page accessed via MacWeb. This logo down here in the bottom right is kind of our go-to logo for Work Green. I'll take you on to MacWeb to show you where that's located. So time off award credits may be earned while on the job or outside of work. How do you earn said How do you earn said credits, do you ask? Credits can be earned by participating in webinars and courses that are focused on the environment and are housed at MacTalent. I'll show you where those are located. Participating in in-person activities such as stream cleanups, and taking part in environmentally friendly activities in your office, such as a green team. 10 earned credits over the course of a fiscal year equate 4 additional hours of PTO, and 20 earned credits over the course of a fiscal year equate 8 additional hours of PTO. I do want to stress that we are working to increase the amount of virtual opportunities that exist for Work Green, because while, yes, we do want you all to get out into the environment, we're still in a pandemic and not everyone is necessarily comfortable with going out and cleaning up a stream with a bunch of strangers. So on top of the webinars and courses that I just spoke about, you can also earn credits via commuting to work by alternative transportation. So bike, bus, carpooling, vanpooling, light rail, volunteering with local environmentally focused groups, and watching environmentally focused documentaries online. So those last 2 bullets, local environmentally focused groups, we do have some opportunities on our website that I'm going to show you all, but that list is not inclusive. If you volunteer with other environmentally focused groups throughout the county, that can definitely be used. I just want to stress that the opportunities that we have listed are not the only opportunities that exist. And when watching environmentally focused documentaries online, we ask that you all reflect on what you learn from those documentaries and how you can apply that information to either your personal life or your work life. So I'm going to stop share, and then I'm going to reshare just MacWeb, where all this information is located. Okay, so hopefully you've visited MacWeb in the past. It's kind of our go-to intranet. If you scroll down to under other enterprise services, this will take you to the Work Green page. If you click on the Work Green page, it takes you to our Work Green site. The site is it's pretty bare bones intentionally because the program can be a little convoluted. And so we wanted to keep it as simplistic as possible. If you go into find activities, this will take you to, excuse me, this will take you to our list of in-person events. Like I mentioned, this is not an exhaustive list. We also have some other events that are listed down here that you can kind of go on a self-guided tour of different things. Our documentaries are listed down here. We have our free documentaries, so open source, YouTube, what have you, and then paid service documentaries, which are on Netflix, Hulu, HBO, what have you. If we go back one, I'll show you all how to log your credits and then also show you how to get to these webinars and courses that I keep speaking to. So if you go back to the WorkGreen site, go down to log and track credits. This will take you to, let's hit log and track credits again. This will take you to our Qualtrics form. You put in your name and please be sure to type in your correct email address. This is the only way that we can ensure that you get that additional time off awarded. So you select your department and then that will take you to a drop-down list of different opportunities. So just select whichever one is most applicable and go from there. In terms of where this information is located within McTalent, I have it pulled up because of this bar. I can't click on it, so give me just 30 more seconds. Within McTalent, we, like I mentioned, are working to increase the amount of webinars and courses that are focused on the environment. And if you search for training, you can filter those courses that are offered within McTalent via subject matter. And so one of those subject matters is WorkGreen. And so you can see there's 5 located here. The goal is to have 10 by the end of this calendar year. I believe that will exist, and I hope that we'll fulfill that. I'm going to stop sharing and see if there's any questions for me.
Let's see. I don't think so, Erin.
Great. Thank you all for the time. Appreciate it.
Thank you, Erin. So we have officially concluded the presentation, but the vendors, the carriers, business partners are around to answer any additional questions that we have for the remainder of the time. And I'm looking at it, it looks like it's 11:29. So we have time for a few more questions, but we do have a large group today. I think we were around 96 participants, something like that. So if we don't get to your question, we will follow up and respond to it via email. And I will say before I open it up for question, we've had several, I saw briefly in the chat, several inquiries regarding the vision coverage under the medical plan. And so I'm just going to say that we are reaching out. I believe Maria has reached out, as well as Jasmine has reached out to Blue Cross for a response.
Wanda, I don't want to interrupt, but I'm actually typing in the response right now for those asking about the eligibility under medical.
Mm-hmm.
So vision services filed with a medical diagnosis will apply benefits based on applicable in or out of network at the place of service. With an HSA plan, they are subject to the deductible and the coinsurance. With the PPO plan, an office visit will apply to the copay, which should be a specialist copay if seeing an ophthalmologist. Blue Cross Blue Shield also mentioned to keep in mind that it's not a guarantee of payment. Eligibility and benefit determinations will be made at the time of the claim is reviewed and processed. So depending on the diagnostic and if it's considered a medical reason, they will determine if it falls under medical claim.
Thank you,
I'm still
Maria.
adding that. Yes, no problem. I'm still adding that so that if anybody needs to see that as well on the chat.
Great. So Madison, do you have some questions for us in the chat?
I do. I have several. The first question, I started a pet insurance plan July 2020. Will it renew January 1 or next July?
Oh, that is a good question. I'm going to have to take that back and get a response.
Hey, Wanda, next July.
Next July?
The pet insurance runs and renews a year from when you signed up.
Thank you, Courtney.
No, you're welcome.
All right, our next question, with the elective plans through Colonial, once you retire from the county, can you opt to still have those plans after retirement?
Those plans are considered portable, and the individual will need to work with the carrier directly to port it. Because once you end separation or separate service with Mecklenburg County, it becomes an individual plan rather than a group plan.
All right, our next question, if payments are made in the college plan, but later the child decides not to go to college, what happens to the money? Can I get it back?
That is your money, but you should consult with your tax advisor. Just to be on the safe side, that is your money.
All right, the next few questions are about the drawing. If I enroll November 9, will you be entered into all 4 drawings?
Maria, I believe so, right? So once you enroll, once you've made your election, you are eligible to participate in all of the drawings unless you win. Now, once you won, then your name is taken out of the hat.
All right, let's see. Next question, can you talk about healthcare coverage for an employee's children 18 through 26? What are the eligibility criteria?
If I'm understanding that question correctly, I want to paraphrase it. You're asking, can the child between the age of 18 and 26 be covered on our medical plan? I'm kind of rephrasing it. If they are eligible dependents and they have been deemed eligible by Alight, this is something that Alight, a third-party business partner of the county, verifies whether the dependents are truly eligible or not. The employee would have to provide proof of relationship. If Alight has determined that yes, the dependent between the age of 18 and 26 are eligible, then they are entitled to participate and take advantage of the benefits, our plan benefits, just like you are. So they would be eligible for medical coverage if you enroll them, as well as the opportunity to take advantage of the clinic, marathon clinic. But they have to be an eligible dependent participating in the plan.
All right, the next question, my child is covered under her dad's plan. May I use my HSA dollars to cover my portion of her expenses?
Yes.
Next question, can you repeat when we can make changes to life insurance?
Mm-hmm. You can make changes to your supplemental life insurance. When you say changes, I'm going to say increasing the amount. Life insurance we typically not had life insurance in our open enrollment process. If you've been here for a little while, you probably noticed that life insurance is not included into the open enrollment period. But you can make changes to your supplemental life plan once a year, okay? You can make beneficiary changes, the life insurance beneficiary changes anytime. So from going from tier to tier, an increase or a decrease, you can do that once a year.
All right, the next question, I have insurance through my partner. If he changes jobs, can I enroll if/when I lose insurance through him?
That would be considered, and Maria, keep me honest here, that would be considered a qualified family status change.
Yes.
Okay. So that there are 2 times outside of new hire election that employees can make changes to their benefits. Open enrollment, and when there is a qualified status change or qualified family status change. Loss of job or employment is considered one of those, just like a new baby or you're getting married, something like that. Loss of job is considered a qualified family status change. So I know at Madison, we've got a lot of questions. I've recognized that, but unfortunately, I have to be mindful of our time. So I'm going to have to cut it off here. I've really enjoyed the questions, very good questions. Just remind everyone that, you know, the resource is out there. Take a look at the virtual benefit fair, great tool. You have the resource page that's in your open enrollment guide. That guide is another great tool to have. And you can always call the Employee Services Center. If they can't answer the question, they will certainly escalate it to someone in benefits, and we will try to answer it. And if not, we will reach out to someone who can, our partners. So we will do our very best to answer any questions that you all may have. Again, I thank you all for taking the time to join us today. Appreciate it. And don't forget, open enrollment is right around the corner. Thank you.